Here we are going to overview few question and answer, and this question and answer already came in the previous NCLEX board exam. The first question, a boy, age is 4 years old, began to use curse word, means offensive word, offensive language. So concerned about this behavior, his parents asked the nurse how to discourage it. Which advice should the nurse offer? So if my boy behave like this, talk or use the word which is offensive, how we control it? The 4 options. So I talk to the nurse, and nurse, what should be advised? Number 1, just ignore it, and he will grow out of it. Number 2, tell him it is not acceptable, right? And he will be disciplined if he continue to do it. Number 3, tell him that good little boy do not use any offensive word. Number 4, tell him that his behavior makes you angry. There are 4 options. Which one is more acceptable? When we work in the floor, sometimes our patient do something look like this. They throw any offensive word to us, healthcare provider. Then what we respond, how we respond, right? Then we should tell it is not acceptable, right? So let's like my boy who has used this type of behavior, tell him it is not acceptable and he will be disciplined if he continue to do it. What is their explanation, rationale? The nurse should advise the parents to tell him it is not acceptable, because by explaining their objection and expectations, the parents teach the child why the behavior is unacceptable and help him understand that he must stop it. We go for good counseling, because parents is the first teacher, best teacher for the kids, and education always starts from the home. So how my children behave, physically or directly, indirectly, it depends upon my behaviors, how I teach him or her. So would not teach the child that his behavior is inappropriate. Also advising the parents to tell him, good little boy, do not use the offensive word, would reinforce the impression that the child is bad. Also diminished his self-image while doing little to change the objectionable behavior.